Good evening, everyone. My name is Shivendra Srivastava, and I'm first year PhD student at UNL. I came to know I'm the first person to get Hubbard Fellowship. So I'm thankful to Dr. Roy, my advisor, and to DWFI for giving me this opportunity. At present, I'm working on three projects. The first project is like impact of flood on public health. The second work which I'm doing is on conservation practices and their impact on water quality and flooding. And my last work is on social vulnerability group in terms of conservation practices, like how social vulnerability affect the conservation practices across the state of Nebraska. For this presentation, I prepared for my first topic, like the comprehensive study on the flood risk in context to public health. For this, I would like to tell you this presentation is basically of two things. The first is the review paper, which I completed in first semester of my PhD. And now it's under review and probably will be published in next couple of months. And the upcoming work, which I'm planning to develop my own framework in context to public health, like how flood is impacting the public health. Yeah. Just to give you introduction, how the risk assessment is being done till now. So if you go through IPCC statement, like they use simply three things like hazard, exposure, and vulnerability for the quantification of flood risk. And that is something which is used by most of the authors for the quantification of flood risk. But recent study, like the study which is done by Simpson et al., they have kind of included one more variable to it. So it's you can see there is hazard, exposure, vulnerability, and response. So we are kind of working on that aspect, like how we can modify this framework. It's not like modifying framework just because we want novelty in that. We are working more on conceptual part, how the things can be changed more. So me and my advisor have like lots of discussion, like what exactly we can do new in this, and we are working on it. Maybe I will explain it next slides. And yeah, so in context to public health, we can see the health infrastructure, food security, and displacement. These are the three factors which impacts most, and these are the major reason where we get the lots of consequences of public health. Now the question comes, why these three factors are being included in presentation, not more than that. So this is just results of different review paper which I have carried out. Actually, it was more than 150 papers which I read, and from that I came up with three big things, like three big we can say classification. On that we can sub classify different other factors. So yeah, you can see this framework. If you go through this framework, you can see the hazard, vulnerability, exposure, and response. And the what Simpson did, they have divided the risk estimation in three parts. Like first of all, they used to quantify the risk with one event, and then they have bring the concept of compound events, like how different events occur at a time and how they are impacting. So you can see the second stage, category 2, where you can see the multiple interaction among hazard, among variables, vulnerabilities, exposure, and response. And the end of the, like if you see category C, where you can see the multiple risk interacting at the same time. Now, what we are planning is we are kind of interested more in policies, because we know at the end of the day, it all boils down to the policies at bigger picture, because it's the policy which govern all these situations. So kind of we are on the verge of it's our idea, like to bring policy in replacement of response for our risk framework. But it's very early to say, like we'll come up with this. We'll try to figure out more research, more kind of literature reviews, more kind of discussion with different people, and then try to come up with some more exhaustive framework. Yeah, in context of risk, like there are so many variables which are being used, but these are the something like this. If you see the compound event, coping capacity, adaptive capacity, these are something which are being less used till now. Like if you see that coping capacity and adaptive capacity, you don't find it in most of the, like not in most of the time, like in general you don't find this consideration while you estimate the risk. So we are kind of interested in this also, like how movement, constraint, and survival in context of coping capacity, and how the learning, reinvention, and long-term aspect in context of adaptive capacity works. Now, this slide is just for your attention, like what different parameters we found, like which are important, in context of public health. We can see the health infrastructure, displacement, and food security. There are lots of variables still there, and at the right side of the slide, we can see the consequences in terms of immediate term, medium term, long term. These are just the literature review which I have done, and from that I bring the most of the things which are cited most, number of times. And this is now framework like which I am working. This is kind of very temporary. It's still like it's have only 50, I guess 40, 30 to 40 variables here, but I have like list of 50 to 60 variables which I am kind of on planning to include all those things and come up with a framework which will include the public health in flood risk estimation. For now, there is no, in my knowledge, there is no framework which has built both things at a time. Like you can get a public framework separate, and you can get a flood risk estimation separately. So I'm kind of interested, bringing all those things in a one single tree. And this is kind of, it's not complete till now, but yeah, somehow we'll try to finish it probably in next couple of semester, because I have some other works also. So yeah, this is something which I have done. Any questions? And yeah, thank you.